going to discuss helping a client to take medication. The client is sitting at a table for this task or sitting up in their bed. The client is unable to open the medicine bottle or pour his or her medication. The medication bottle contains candies so that the candidate can pretend to the medication pills for the test. And the role of the client is always going to be played by somebody that's testing with you, but for this we're using our mannequin. So keep in mind that the client is not able to discern what medication. That's up to you as the home care aide to get the medications ready. So I want you to pay close attention to this task because there's things that you can do and there's things that you cannot do. The first thing, once again, is your common care practices. You will make sure you knock on the door and close the door for privacy and let the client know you're there and who you are. Hi, Mr. Client. I'm Hope Linder. How are you today? Oh, Mrs. Client, your hair looks beautiful. Did you just get it done? Okay, well, I hear that you just had a wonderful breakfast and it's now time to take your morning meds. So did you see how we did our common care practices? We alerted the client that we were here. We also told the client what we were going to do. And now I'm going to ask the client, is it okay if you take your morning meds? Great. The client is fine with that. Excuse me. The next thing you're going to do is make sure you have already washed your hands for precautions. And I wear gloves for this task, and I recommend that you do also. And the reason being is because you're going to be touching the client's meds and also putting it from the cup into the client's cup, and you just want to make sure that you have some precautions. So make sure for this task that you do wear gloves. So for this task, you're going to make sure the client has a cup with water and a straw. You're going to also make sure you have a tissue nearby in case the client has any kind of drool or spit, if they've choked from trying to take a pill down. So it's just great to have. You're going to make sure that you have the client's medicines. So whatever the meds are for that client, you'll make sure you have them. And also a medicine cap. The next thing you're going to need is you're going to need to know what medication the client is to take. So you'll make sure that you have the client's medication list, which will be left at the client's home. There's 5 things you need to know which are very, very important for this task. That's the 5 rights of medicine administration. That is, know the patient, know what drug or medicine that you're giving the client, make sure you know what dose, how it's supposed to be taken, which is called the route, and also what time. So let's go over our 5 rights again. That would be the patient or the client, the medicine or the drug, the dose, which will be on the prescription and will also be on the order, the route, which will also tell you on the prescription bottle how they're to have it. Some might say in applesauce, some might say by mouth, and if you're nurse delegated, it may say from a syringe. So it's important that you know what route and what time. Are they to take it in the morning, afternoon, or evening? So those are our 5 rights. So we're going to look today. So this is how we're going to do this. So, Mrs. Jane Bubba, I see that your birthday is September 15th of 1951. Is that correct? Wow, that's great. And I see that you're supposed to take 1 candy-coated peanut 2 times daily with meals. And it says 1 is supposed to be in the morning after breakfast and 1 in the evening after dinner. Well, we just started the task saying that the client had just finished breakfast. So we know this is their morning meds. So let's look and see. Candy-coated peanuts. The generic name would be called Boston Baked Beans. Let's see. Candy-coated peanuts, Boston Baked Beans. Take 1 tablet 2 times daily with meals or after meals for diabetes. Fine? So, now we know it is Jane B. Bubba. Jane B. Bubba. Are you Jane Bubba? We see the date of birth is 9/15 of 51. 9/15 of 51. Great. Then we see she's to take 1 tablet 2 times a day with meals or right after meals by mouth. Okay. So did you eat breakfast this morning? You did great. So it says that I can give you 1 of these. So you will pour 1 prescription into the lid of the medicine bottle and then pour that pill into the medication cup. Does everybody have that? This, what I'm going to show you, is a no-no. You do not do this. That is not acceptable, and that will not pass this task. So let's do this again. You'll take 1 prescription, and you're looking again. I'm having 1 candy-coated peanut, Boston Baked Beans, at 8 a.m. or after breakfast. By mouth, okay, that's great. So now that one is done. Do you see what you have done? You have used your 5 rights that we went over for that prescription. Let's go to the next one. Lemon candy. Take 1 tablet at bedtime. So we're not going to need that one because this is in the morning. Cinnamon flavored candy Red Hots. Take 2 daily in the morning after breakfast by mouth for her hypertension. Let's see. This says Jane Bubba. Jane Bubba. And your birthday is September 15th of 1951. And it says 2 tablets in the morning by mouth for hypertension. Okay. So now you've verified that once again with your 5 rights. So you'll take 2 of these and put them in her cup. Are you with me? It's important that you do each step. To some of us, we may feel this is redundant, but for your test, you're going to have to really look on your prescription and make sure this client and the birth date and the route and the dose match the prescription. So be very careful to look at everything. Don't go through this with a fast, speedy, I don't care attitude. Now what we're going to do is we're going to place the meds in the client's hand. Are you ready? Are you not comfortable? Let's get you comfortable. How's that? Oh, is that good? All right. So now you're going to put this in the client's hand. Do you see that? And we're going to help the client by putting these in the hand and assisting the client to put it to the client's mouth. We are not allowed to do this. We can't do that. Now, if the client can't use their hand, you can do this. But you cannot take them out of their hand and put them in their mouth. You can put the pill cup in their hand and do this and assist them. If you have to physically give the medication to the client, you have to be nurse delegated for that. So if you're not nurse delegated and an RN has not come out and delegated you, you cannot physically put this medicine in the client's mouth. So I want to make that very clear. We can assist by putting this in their hand and helping them. Throughout this, you're going to offer their water. Come on, Mrs. Bubba, we want you to drink. Drink, drink. The doctor wants you to drink plenty of water with this prescription. Let's see if we can get you to drink all this water. Great. How are you doing? Let me see in your mouth if you've taken your pills. Oh, I don't see them. So now you're assuring that the client has taken the right medication by using your 5 rights. You're also going to make sure that you've encouraged them to drink all their liquid. And you're also going to make sure you looked inside the client's mouth to make sure they have swallowed their medicine. If they have not, encourage them to drink some more and continue swallowing until you see that their mouth is clear and free of any medication that they have taken. At this point, this task has been completed. So you'll make sure that there's no water or slobber on your client's mouth. You'll make sure that the client's medications go back into their proper place. You've taken off your gloves in the proper manner. You've disposed of them, and you've asked, Mrs. Client, is there anything I can get you before I leave? Here is your phone and your remote, and it looks like the Young and the Restless is beginning. You're now done with this task, and your client is comfortable, and you can now be done.